My name is Dr. Shahid. I'm a general pediatrician and medical educator. And today we're going to talk about a very important topic, the topic of emotional intelligence. This is a skill that is necessary for all medical students and all physicians in order to be successful. So I think this is something that needs to be taught in medical school, in training, and in practicing physicians to remind them of the importance of developing good relationships with other people. So let's talk about emotional intelligence and why it is so important for medical students and physicians to have. So first of all, let's define emotional intelligence. What is emotional intelligence? There's lots of different definitions of emotional intelligence. The one I like is this one here, where they define emotional intelligence as your ability to recognize and understand emotions in yourself and others, and your ability to use this awareness to manage your behavior and relationships. So emotional intelligence is all about understanding your emotions and how those emotions can affect your behavior, how those emotions can affect your interactions with other people, and how those emotions can potentially affect your ability to build a strong relationship with another person. So I think it's a very important topic that needs to be addressed for anybody interacting with patients, especially. So we know from research that emotional intelligence is a very important skill for leaders to have. Some people think that to be an effective leader, you have to have a high degree of emotional intelligence, and that is the most important skill to have. And that emotional intelligence is more important than your technical skills and even your IQ. So in order to be an effective leader, you have to be good at what you do. You have to have good technical skills, and you have to be smart. So you have to have a high IQ. But it's felt that emotional intelligence, or your EQ, which is a measure of your emotional intelligence, your emotional quotient, is more important for a leader than your IQ and your technical skills. So I think it's very important to keep this in mind. And there's lots of ways that you can measure your own EQ or your own emotional intelligence. There's many validated tools that are available to assess. Most of them cost money, but it is important to get a self-assessment of your own emotional intelligence level to help you become a better medical student and a better physician. So we know from the literature that there's a positive correlation between emotional intelligence and many outcomes, such as leadership success, such as employee morale, job satisfaction, job commitment, teamwork, customer satisfaction, decreased turnover, and less work-family conflict. So there's so many important aspects of emotional intelligence that have been shown to be important. So emotional intelligence is not only important in your professional life, but it's also important in your personal life, because it's all about building strong relationships with other people. So this study showed that the medical community is now finally becoming aware of the value of EI skills. So this study was published in 2008, and actually the concept of emotional intelligence is back from the 1990s. So it took about 15 years for the medical community to understand the value of emotional intelligence skills. But now there's a lot more emphasis on emotional intelligence and teaching emotional intelligence as part of medical education. And I think that's a very important area that needs to be taught to our medical students and to our trainees. This study found that emotional intelligence is a critical healthcare leadership competency. So it is very important to have good emotional intelligence skills as a leader. And most people, most physicians, they're thrown into different leadership roles without a lot of training, but emotional intelligence can help them be successful in those leadership roles. But beyond leadership, emotional intelligence is a key competency in the clinical setting as well. So whether you're a chairperson and you're an administrator and you're in the boardroom, it's very important from that perspective, but it's also very important in the clinical setting, in your office, at the bedside, on the ward. So it is very important in the clinical setting as well, and that's why it's so important to talk about emotional intelligence for medical students and for trainees and for practicing physicians. The literature suggests that doctors who have a high emotional intelligence level, that is positively correlated with patient trust, which in turn is correlated with better patient follow-up and better doctor-patient relationships and increased patient satisfaction. So it is such an important aspect of developing a rapport with your patients, developing a strong relationship with your patients, and having better outcomes with your patients. So emotional intelligence is a very important skill for doctors to have as they interact with their patients. We also know that a doctor's level of emotional intelligence is positively correlated with less burnout and higher levels of job satisfaction. And there's many more articles coming out now talking about how emotional intelligence can be protective against burnout and can help promote wellness and promote resilience. So let's get back to our definition. Why do I like this definition? So we said emotional intelligence is your ability to recognize and understand emotions in yourself and others, and your ability to use this awareness to manage your behavior and relationships. And why do I specifically like this definition? Because it really focuses on the fact that emotional intelligence is all about managing your behavior in an effort to develop strong relationships with other people. And why are relationships important? Because the most important single ingredient in the formula of success is knowing how to get along with people. This really is the goal of emotional intelligence. The goal of emotional intelligence is to build strong relationships with other people. And if you want to be successful in anything that you do, you have to be able to get along with people. You have to be able to develop strong relationships with people. And again, that's the goal of emotional intelligence. And in the healthcare setting, that is so important because we all work as part of a healthcare team. Whether you're the medical student, whether you're a resident, you're part of the house staff, you're an attending physician, you're a faculty member, you're a practicing physician, whether you're in the hospital, you're in your office, whatever setting you're in, everybody's working as part of the healthcare team. There are nurses, there are social workers, there are practice managers, there are office managers. There are so many people, dietitians, pharmacists, so many people that the healthcare team is comprised of. And emotional intelligence skills allows you to develop a strong teamwork with everybody that is part of that healthcare team because you can build strong relationships with them by using these emotional intelligence skills. So that's why it is so important to develop emotional intelligence skills as a healthcare provider, especially because we all work as part of the healthcare team in whatever capacity we might be working in. Okay, so there's different models of emotional intelligence. The most common model and paradigm talks about emotional intelligence and breaks it up into these four components. First one is self-awareness, then you have self-management, and then you have social awareness, and you have social skill or relationship management. So self-awareness is being aware of your emotions and how they affect you and how they affect others around you. Self-management is being able to manage and control your emotions. Social awareness is being aware of how you socially interact with others and how you are perceived by others through those interactions. And social skill is the ability to build strong relationships with other people. We're going to talk about each one of these separately. And in this particular video, this is just the first part. We're going to be focusing on self-awareness and self-management. And then in part two, which will be a separate video, we're going to talk about social awareness and social skill. I think one thing I want to really emphasize here is that emotional intelligence is a skill that can be developed, that can be improved upon, that can be taught, that can be, again, developed and improved upon. So it's different than your IQ, right? You're born with a certain IQ and you can't really change that. But your EQ or your emotional quotient or your measurement of your emotional intelligence level can be improved. It can be taught. You can get training in it, and it is a skill that can be developed. So I think that's an important aspect to keep in mind. So now let's talk about a couple of these components. Again, in this video, we're going to talk about self-awareness and self-management, and in part two, we're going to talk about social awareness and social skill. So self-awareness, we said again, this is being aware of your emotions and how they affect you and how they affect others around you. So self-awareness is your ability to recognize and understand your mood and your emotions and their effect on others. And it's your ability to recognize how your feelings affect you. And more importantly, how those feelings affect others around you. So what does that mean? If you show up to work in a bad mood and you're always angry and you're always negative and you're always kind of unhappy, right? That's going to have an effect on your team and everyone else around you, right? But if you show up to work and you're happy and you're positive and you're smiling and you're saying good morning to everyone around you, that's going to have a very different effect on everyone around you and the team around you then. So again, self-awareness is being aware of the fact that your mood can really affect the mood and morale of everyone else around you, right? And especially if you're the leader of that team, right? If you're the, a senior resident, or if you're the faculty member, or the attending, or you're the the senior physician in a practice, if you're the leader of that team, it is so important for you to set the mood and the morale and the tone of everyone else around you, and you recognize that your mood, your emotions really affects that and makes a huge impact on that. So self-awareness, again, is being aware that your mood can really affect the mood and morale of everyone else around you. So so keep that in mind as you're interacting with everyone in your team and everyone else around you, especially if you're in a leadership role and leading that team. So what are some qualities of a person with self-awareness? Those include commitment, passion, humility, and then developing yourself or teachability. So when you have good self-awareness skills, you are committed to your goals, right? You are aware of your goals, first of all, your short-term goals and your long-term goals, and then you are passionate and committed to achieving those goals. So a person with self-awareness has that commitment and passion toward achieving those goals. When you have self-awareness, you know that you are not perfect, right? You know you're going to make mistakes. And because of that, you are humble and you have humility. You are not arrogant, right? Because you know you're not perfect. You know you're going to make mistakes because you have that self-awareness. So that allows you to have that humility and be humble and not be arrogant. Another quality of a person with self-awareness includes being able to develop yourself. So when you are aware of the fact that you are not perfect and you make mistakes and that you have areas of weakness that you can improve upon, then you can develop those skills that you might be weaker in. So you are teachable in developing those skills then. So that's another quality of a person with self-awareness. So again, self-awareness is being aware that your emotions affect your behavior. Your emotions affect your interaction, and your emotions affect your ability to develop strong relationships with other people. So having that self-awareness is so important then. Okay, so now let's move on to the second component that we want to talk about in this video is self-management. We said self-management is the ability to manage and control your emotions. So it's your ability to use awareness of your emotions to actively choose what to say or do. It's your ability to manage your emotional reactions to situations and people. So what does that mean? That means that you are able to control your emotions and control what you are saying and what you are doing, right? You don't let your emotions get the best of you, right? So you don't let emotions hijack what you are saying and what you are doing then, right? So that's part of self-management, right? And your ability to manage your emotional reactions to situations and people. So what does that mean? You can't control someone else's actions, right? They're going to do what they want. They're going to behave in the way that they want, right? So you can't control another person's actions, right? But you can certainly control your reaction. And you have to make sure that your reaction is an emotionally intelligent reaction, right? That you manage it and you control your reaction to that situation then. Part of self-management is having self-control. And that means that you have the ability to keep disruptive emotions and impulses under control. So when you feel yourself getting angry or frustrated or you're about to lose your temper, right? You control that, right? You control those impulses. Because if you start yelling and screaming at other people and another person or other, especially in the middle of a hallway around other people, that's not going to help your relationship with that person, right? That's going to really hurt your relationship with that other person. And again, if you're the leader of a team and you start yelling and screaming at someone, in front of everyone else, that's really going to hurt your relationship with that person and everyone else in the team around you. So that's such an important aspect of emotional intelligence, of self-control, and of self-management. The second part of self-control is the propensity to suspend judgment. What does that mean? That means you don't make assumptions about other people. You don't make quick judgments about other people. You give people the benefit of the doubt. So that's an important aspect as well. And the third component of self-control and self-management is the ability to think before speaking or acting, right? So think before you say something. Think before you do something, right? Is it going to be taken the wrong way? Is it going to come across as insulting or offensive or condescending or humiliating or embarrassing, right? So think before you say something, think before you do something. How will it come across to the other person? right? So I think that is so important. Is it going to hurt your relationship with that other person, or is it going to help develop that relationship further? So think before you say something. Think before you do something, right? What impact and effect is it going to have on the other person? And nowadays it's more than just think before you speak or think before you act, right? Now you think before you send that text, right? Think before you send that email, right? Think before you send that tweet, or think before you post something on Instagram or Snapchat or whatever, right? Think before you communicate in any way. Will it come across in a way that you did not intend it to be, right? Will it come across as offensive or insensitive or insulting, or condescending or disrespectful or whatever, right? So think before you hit that send button, right? Think before you post something, right? So I think that's very important. So think before you communicate in any way, right? It used to be that you need to make sure that you learn to control your tongue. Now it's you need to learn to control your thumb, right? In this day and age now, I think that mode of communication can be very, very problematic. So think before you speak, think before you act, and think before you do something, think before you post something, think before you send something, tweet something, anything, right? Think about the impact it's going to have on the other on the other person then. Okay, so what are some qualities of a person with self-management skills? So those include patience, self-control, self-discipline, integrity, and honesty, right? So when you have good self-management skills and good emotional intelligence skills, you are patient, right? Meaning that when when someone makes a mistake or you're getting angry or upset, right? You don't lose your temper, you don't start yelling and screaming at them, you are patient with them, you are tolerant of them, yeah, and you are patient and you work with them, right? So then that's part of self-control, right? So you're able to control your feelings, control your emotions, control your temper. That's part of self-control. Self-discipline is that you're disciplined enough to be able to be patient and to have self-control, and you have that self-discipline to be able to be a good leader, to be the example for your team. And then integrity and honesty. So integrity is making sure you stick to your values, and honesty is making sure that you're always truthful. So these are some qualities of a person with self-management skills. Okay, so with that, that was an overview of emotional intelligence, and also some discussion about self-awareness and self-management, and that is what we're going to cover in part one of these videos on emotional intelligence. And in the second part, the final part, which is part two, we're going to talk about social awareness and social skill. These are some of the references that I've used for this talk, and I'll be using for the second talk as well. So I want to thank you for your time, and hope to see you at part two, and we'll finish the discussion on emotional intelligence then.